Years ago, I was in graduate school working on a PhD in sociology. And in the library, I came across the report on health of racial and ethnic minorities in the United States. The report showed that African Americans had the worst health profile of any ethnic group in the country. Health disparities cost the U.S. economy $1.24 trillion because people are sicker than they should be and they're dying younger than they should be dying. One of the myths that a lot of people have, and I think misunderstand, is that they think that because African American men have a lower life expectancy and higher mortality rate than every other group by gender and also by ethnicity, that we're dying of these exotic diseases. The truth is that the leading causes of death for African American men are the same leading causes of death for every other group. It's heart disease, cancer, and stroke, the big three causes of death. The reason for the disparities, I believe, is that we live much more stressful lives. And I think there's the normal stress that anyone has, and then you have the additional stress, the cost of the effects of race and racism. And you find racism really in three different categories. There's institutionalized racism, there's interpersonal racism, and there's internalized racism. Institutional racism is the way that society is organized, the way that the structure of society places differential levels of burden on people. We have interpersonal racism, which is the category that gets the most attention, which is bigotry, discrimination, being treated badly by individuals because of your race or ethnicity. The final category is internalized racism. Because they devalue their own lives, because we live in a society that tells us that our lives ought to be devalued, we also tend to sometimes devalue each other. So there is a certain stress associated with just being African American in a society that tells you that your life is not as valuable. If black men don't study black men, if black men don't change the narrative about ourselves, then no one is going to do it. The idea was to bring together a group of black male researchers who would focus on black men to help us to change the narrative and improve the lives of our brothers. And there's no way that you're going to have a healthy family if you don't have healthy black men. What people can do to help this initiative is to, if you're a black male, take the survey, become a part of this project, contribute your life experience to the knowledge base that we're collecting so that we can learn how we can improve the health of all of us. If you know a black male, encourage him to participate. If you love a black male, encourage him to participate. This is about us, this is for us, and this is to improve the length and the quality of our lives.